afternoon. My name is Phyllis Brennan. I was born and raised here, but I lived in New Jersey for over 30 years, and I had a fabulous life there. Fabulous. So if you're from Jersey, I line up with you. I want to tell you, first of all, that I voted for John McCain. But I am not a registered Republican or a registered Democrat. The reason I wanted to speak to you today is because a lot of things have been said about health care. I want you to think about this number. Do you know what 80 million plus is? That is the number of eligible voters who did not vote in the last election. 80 million plus people. So if you manage to get this health care bill changed to what it should be, and health care should be changed in this country, because I took care of my mother who had dementia, and there is not enough I can say about hospice. We were very, very, very lucky because we had the money to pay for whatever we needed to do for our mother, and not everybody is that lucky. But if you manage to get this health care bill changed, you should remember that you're not going to go home and sit down and not do anything else. You need to remember that 80 million plus people did not vote, and they are responsible for part of the situation that we find ourselves in. Your vote is your weapon, not your gun, your vote. And I hope everybody will vote. And I love the picture. If I'd have known they had the picture, I would have brought the cutout of the body and you could have stuck it on him.
My name is Wayne Carpenter. I am born and raised here in North Carolina, but I have had the opportunity to live overseas. I lived in Spain during the time that PSOE was in power, which is the Socialist Party in Spain. And my question to the Senator is, if so many countries around the world, France, Spain, Canada, Australia, New Zealand, Russia, who all have these nationalized healthcare systems that are bankrupt, do our politicians believe that they are so intellectually superior that they can run it better and keep it from going bankrupt and the same problems than the entire rest of the world? Are we that much smarter than everybody else? And I say that jokingly, but I say that very seriously as well. Do we really think that we can overcome all of the problems that all of these other countries are trying to get away from? The hospitals in Spain are empty. There are no doctors. So, if you want to see a doctor, you might wait 8-10 months to a year for something as simple as a wart on your toe, because the doctors are paid by the government under their healthcare system, which means people do not want to become doctors. And those doctors that were doctors have left. So, Senator, my question then is, if so many countries are getting away from it, why are we running towards it?
My name's Ellie. I'm from, well, not from Wilmington. I live in Wilmington. I haven't been bused. I'm not as funny as some of the speakers that you've heard. I'm not as articulate, and I'm going to try to not use negative characterizations of the people I disagree with, or even that I might agree with some of the time, to describe my thoughts. And I'm nervous, and I didn't expect to be like at the end. Like many of you and many of the people in our country, I'm afraid, I'm concerned, I'm frustrated, I feel impotent. On the other hand, I'm a citizen, I vote when the time comes, because I'm just a young thing. Maybe I'll collect Social Security. Maybe I'll be on Medicare, except if I were to have to do it now, I couldn't afford to do it. Because to be on Medicare, you also have to have a health insurance plan. And I know I can't afford to pay for both. Did you know that you have to do that currently? And the health insurance plan, the health insurers can change that plan. If I were to work and change jobs, maybe that health insurance company would continue to insure me. If I got a disease or had a pre-existing condition, the way it stands now, I could lose the health insurance even if I didn't change jobs. It's up to them. They're bureaucrats with no control, at their whim, can change, and they do change, and some of you already know that. There are prescriptions that they can choose not to pay for. Or there are drugs that they say you can only, that they will only cover the generic drug. And there's a difference sometimes between generic and the original drug. Did you know that the insurance companies can do that? They do that now. Their bureaucrats do that now. So frankly, I'd like somebody to be, looking over their shoulder, because they're money making. They're not there to provide health insurance and help us. They're there to keep solvent and to make money. They're not nonprofits. I'm sorry that I'm making somebody yawn. I realize that maybe what I'm saying is a little different than what somebody else has said. This is a complicated situation. Our world is complicated. Lord knows our lives are getting more and more complicated. Frankly, I'd like things to be simple. I wish things could be simple. I wish the health care bill would be 10 pages. Frankly, I'd like it to be bullets on one page. But you can't do that because the devil's in the details. And when it comes to details, I don't want somebody's synopsis of how they interpret what the words are, because that's their interpretation based on their particular point of view. It's not necessarily based on specifics or on facts. And just as the one gentleman, and actually, I don't know what kind of doctor the gentleman